Hello, I'm Dr. Sergio Bardaro. I am the Director of Bariatric and Metabolic Surgery here at MetroHealth Medical Center, Case Western Reserve University. And today we are in Cleveland very early, 6:30 in the morning. And we welcome you to our interview with our Chairman of Surgery, Dr. Christopher Brandt. Dr. Christopher Brandt had been 27 years here at MetroHealth in the faculty, as well as extra 5 years as a resident. So a total of 32 years in our institution. On my left hand, and I want to add that Dr. Brandt is an accredited examiner of the American Board of Surgery, as well as the current president of the Association of Surgical Education. And Dr. Christopher McHenry, we have two Chris today, and he's the vice chairman of surgery. He is in charge of general surgery, and he is the recent president of the Central Surgical Association, Midwestern Surgical Association, American Association of Endocrine Surgery. He's he's a director of the American Board of Surgery and the chairman of Surgical Oncology Board. And I am very happy with both of them because they agreed to come very early in the morning to have this interview to share with you. So I will start with the first question, if you don't mind. And the first one will be, who did inspire you to become a physician? I don't know who wants to start.
Well, Dr. McHenry, go.
So my dad really inspired me to become a physician. I watched my dad through, well, certainly as raising our family. I'm one of 10 kids. I have 7 brothers and 2 sisters. I watched him raise our family, and then I also watched him in his career. And the things that really impressed me about my father were his, his work ethic and his love for his patients. Everything he did was to take better care of his patients. He was very dedicated to the people that he worked with. All of his clinical research, his reading, all was to better his care of his patients. And he was really the most influential person in shaping my decision to pursue a career in medicine.
Oh, thank you. What about you, Dr. Brandt?
Well, I'm afraid it's not quite so inspirational, but in looking back, I think it was my mother who decided it'd be a good idea that I apply to medical school. At the time, there was no significant inspiration, but it seemed like a reasonable thing to do when it got to that point. So, but as I got into medical school, as far as getting into surgery, that's where it became pretty clear. The role models that I saw, there were many of the faculty. I'd say in particular, Dr. Jeff Ponsky, who's probably known to many of the people looking at this video, was really a role model as far as his commitment to patient care, innovation, as well as a significant commitment to just education and the joy of the profession.
And if I have to ask you, instead of how did you become a physician, to ask you who inspired you the most during your surgical residency or your surgical training, who would you choose?
Well, there were many, but 2 that really touched me directly and continue to do so, even though they're not still actively operating, were 2 of the faculty here at MetroHealth. One is Dr. Richard Fratianne, the other is Dr. Eddie Mansour. And they just had everything. I mean, they were innovators in their fields. Dr. Fratianne started a burn unit. Dr. Mansour essentially started surgical oncology. But they were so committed to their patients and really committed to educating the next generation, students, residents, and working and developing teams. And that is really something that I think was unusual at the time. But it's become clear how important it is as far as if you really want to develop an excellence in some program, you need to develop the team around you. And they really were a model of that.
So I did my surgical residency training at Loyola University in Chicago.
We all know.
Yeah, during a time when I think there were many the giants in surgery there, and there were many people who impacted me. There was Robert Freark was the chairman then. I got the opportunity to operate with people like Jack Pickelman, Jerry Arana, and John Hoffman, Richard Prins. But there are individual who really had the major impact on my career choice to choose to pursue a career in endocrine surgery was a surgeon named Edward Poloyan. And at the time, he was really known as the gentleman's surgeon. And he was a master in technician, but also at the time, he introduced me to clinical research and basic science research, and he was the individual, one of the major individuals who influenced my career. Also, the person who is ongoing and helped me through my career is Richard Prins. I operated with him during my residency, and throughout my career, he's been a confidant and somebody who I've looked to for help and advice, and he's really been a true mentor to me. And then lastly, Robert Freark, who is the chairman there, I have a little story about him. I did my residency or my fellowship at the University of Toronto, and when I was graduating from my general surgery residency training, there were no major clinical endocrine surgery fellowships in the United States at the time, and so I secured this fellowship at the University of Toronto, but they could only pay for half of my salary. And Dr. Freark asked me if this is something I really wanted to do, and I told him yes. And Dr. Freark paid for the other half of my salary, which I'll be forever grateful to him. So that's the kind of individual that Dr. Freark was, and the people that I had the opportunity to train with at Loyola. I'll never forget my training. It was a great. My residency training is really a significant, had an impact on my career.
That's fantastic. And I want to, please remind me, how many years have you been in MetroHealth?
27. 27, yeah.
And Dr. Brandt, 32. He's the champion. So, but tell me, both of you, what has enticed you to remain so long at MetroHealth and Case Western University? Because nowadays, the average stay of a surgeon or physician in general in an institution is no more than 5 years or 7 years, but here it's different.
I think some of it's related, well, in fact, probably a lot of it's related to the underlying mission of our institution. So we provide great expert tertiary medical care, but the mission of the institution is to provide that care to any member of our community, regardless of their circumstances, financial, social. So, and it's always been a very collegial environment, and I think people are attracted to that basic mission and fundamental purpose. And that has led to people working together a long time through the good and bad. So I think in my mind, it's really working together with people that are dedicated to providing great care to all.
I would agree with that, the comments made by Dr. Brandt. And the single most important factor, well, there's two most important factors for me. The first is the people here. It's just something about the people here, to work with the people here is just tremendous. It's just and that's what keeps you here. You just enjoy the people that you work with, and they're good people. And that has been, and I would agree with Dr. Brandt, that's the single most important factor that's kept me at MetroHealth Medical Center. I think what brought me here to MetroHealth Medical Center in the Cleveland area is my family. I think when you're making initial decisions, and when I tell residents about decisions about their career, I always emphasize that make a decision, it's your family first. And my family is from Cleveland, my wife's family is from Akron, and this is home for us. So you just can't beat it. When you're working at an institution where you love the people that you're working with and your family's happy, that really is makes it hard to leave something like this.
And being part of a university is being just a significant part of the lives of people who are starting their career and you'll be working with, or you'll see the results of their efforts for many, many years. So working with the residents and the students is something that is obviously an important part of our lives and the mission of what we do as faculty.
Yes, well, you said native of Cleveland. You are also a native of Cleveland.
So
you can imagine with this accent, I'm not native from Cleveland.
Well,
I'm coming from
occasionally we'll let
Argentina.
people from Argentina.
But they accepted me well so far, so we will see. Next question is, what surgery do you enjoy the most? Let's go to what you do on a daily basis. What surgery do you enjoy the most? And what little tips you want to share with some of our residents that are looking at us? Just tips.
So I would categorize my career as I would classify myself as a general surgeon with a focused interest in endocrine surgery. And so I love broad-based general surgery, but the my most favorite operation is a parathyroidectomy. And why do I love that so much? It's because of it combines the understanding of anatomy and embryology with the technical aspects of a surgery, and I just really enjoy doing it. And what are the tips? I think you need to understand anatomy, you need to understand embryology, you need to be able to perform your own ultrasound exam, find out where the abnormal tumor is. That'll direct you where you need to go at operation. You need to be able to read your own scans, and you need to be able to take care of the patients postoperatively. And so that's my single favorite operation is parathyroidectomy. So.
I'm not surprised, though.
Well, I got out of the endocrine business once Dr. McHenry got on board, so I'm going to second much of what Chris said. I am a general surgeon at heart, and that's what really attracted me to that part of surgery and continues to do so. I'll say I was a relatively early adopter of minimally invasive surgery here at our institution, so that's always sort of been an important and fun part of my practice. If you had to make me pick one, it's probably laparoscopic repair of a paraesophageal hiatal hernia, because it's something I've developed a little bit of experience over the years and sort of worked through some of the techniques, and it's still a pretty challenging operation, but something I can let residents develop some skills and work together and still feel like we're getting through a pretty tough operation at times. I have no specific tip, if you will, but I think I echo clearly some of what Chris said, which in part is you have to know the anatomy. You need to be prepared. It's about preparation, understanding that particular patient, what you might be running into. Even if you think it's a routine, sometimes things will just come up, and you have to be prepared for the unexpected. And to do that, you really need to know your patient. You need to be prepared for the operation and have a fundamental understanding of the anatomy of how it relates to what you're going to be doing.
Well, it's impressive because in the era of technology and developing new instruments, the fundamental basic knowledge of anatomy, an archaic, I will say, topic perhaps for people, is still important, and sometimes is clearly underestimated during medical school or even after. So I appreciate that. Like deep on my heart, I am an anatomist, and I really appreciate that comment. So one more question. If you had the opportunity to go back and consider your future prospectively, would you take the same path that brought you here? Or you think there are a lot of things you will do something different? Remember, perhaps you won't be sitting on this table, right?
Yeah.
Well, what I have thought has always been interesting is, at least for me, I would never have predicted that my career would have traveled the way it did. And what I tell residents and students, and I think is an important message, is be open to opportunities that come along. don't be afraid to say yes to things, because it might be surprising how it's not what you maybe have planned on or thought you were going to be in the next 5 or 10 years. It's important to think about that and be planning, but be open to opportunities, because things can come your way that you'd be surprised how it might evolve.
So I look back at my own career, and I'm just I just can't be more thankful and thrilled with how things have come along, and I have just been very blessed, privileged with how things have come up, and I truly look back, and I wouldn't have changed a thing. I just I came to MetroHealth Medical Center with as a general surgeon, but I wanted to develop endocrine surgery. And when I came here, there was no endocrine surgery. Dr. Dobbins, who was the prior endocrine surgery at MetroHealth Medical Center, had retired almost 3 years before I came. So there was no endocrine surgery. So I look back, and I really am proud. I take pride in developing an endocrine practice from scratch. And I've loved what I'm doing. I mean, to be able to teach students and residents, to combine that with clinical research, and to be involved in both general and endocrine surgery is really something that I've treasured, and I'm very happy with how my career has progressed.
I can't think of a better career than academic surgery.
Yeah, I completely agree with you.
You get it all.
Yeah, I agree with you. And going back to the last part of your answer, what aspect of being a surgeon do you enjoy the most? I know you both well, and I know what will be your answers, but I would like you to share with them.
I'd like to know what you think my answers are going to be.
Oh, I'm 100% on teaching, you know. I know that you're a good teacher, and you are very well recognized for that. And but just I want you to answer the question. And
I'll answer it in two parts.
Teaching, research, patient care.
For me, it's still about patient care. Patients are looking to you to take care of a problem, and do it with professionalism, skill, and compassion. And when you do that, there's nothing better. They come with a problem. Almost all the time, we take care of it, and it has a great outcome. So it's still about, now a lot of my life now is on the administrative side. And what I have found is what I think is really important, and I get the most out of it, is it's a chance to allow other people to help them in their career, both from a clinical and an academic standpoint. There's just nothing better about it. It's not about budget meetings, I'll tell you that, but it's about helping other faculty move along. Where do they want to go? How can I help?
So mine is patient care, and everything stems from patient care. You derive satisfaction by taking care of patients, by helping them through difficult times in their life, and then everything stems from that. You teach residents and medical students based on your patients. The clinical research that I've been involved with, and even the basic science research that I was involved with early in my career, all stemmed from the patient. Trying to identify problems that you can come up with better solutions for. And so to me, it's all about the most fun, and the reason I got into this career and continue to love the career is it's patient care. And all the others are important, but they all stem from good patient care.
So with this last question, we conclude, but I want to make the last comment. And first of all, I hope you enjoyed this interview. Here we are interviewing successful surgeons, but real people. They are always, even being the chairman and vice chairman, they are very accessible. And they certainly had been a roller in all aspects, not only for students, but also for young faculty, believe it or not, like me. So I hope you enjoy. And the last message I want to tell you is that if you are still not a member of the SSAT, this is the right time to be, and we will welcome you to come. Thank you so much.